Hello everyone, welcome back to Common Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page and the link will be given in the description. In the previous two videos on dynamics of disease transmission, we talked about the different sources and reservoirs of infection and how infection is spread to the susceptible host. That means the different modes of transmission, which could be direct mode or indirect mode. Today we shall talk about the susceptible host. Successful parasitism means how a person or host is infected and then how the infection leaves the host and then it finds another host. Successful parasitism to occur, first there should be a portal of entry. So the organism or the infectious agent must find a portal or route by which it enters the host. It can be respiratory route, it can be gastrointestinal route, it can be genitourinary route, or even skin. Site of election means after entering the host, the organism must find or elect a suitable site where it can survive and multiply in number. After that, it must find a portal of exit. That means the organism must leave the host so that it can find a new host or it can infect another person. Then comes survival, which means after leaving the host, it should be able to survive for some time in the environment until it can find a new host. There are certain terminologies that we discussed in our earlier videos, but this is also in context of today's discussion, so I will be talking about them yet again. First is incubation period. I have given two definitions here. The first one is from the book of Park. It says the time interval between the invasion by an infectious agent and appearance of first sign or symptom of the disease in question. So note two things here, that it is for the infectious agent, so communicable disease. Whenever we are talking about incubation period, we mean communicable infections or communicable diseases. And it is basically the time period or time gap between the entry of the infectious agent and the onset of sign symptoms. The definition from the book of FMC Pune, it says time period between the entry of the infectious agent or its toxin into the human body to the point when the earliest clinical manifestations of the disease are apparent. So basically the same thing but written in different manner. Remember, incubation period means the time gap between the infectious agent entering our body and the onset of any clinical feature. That is the incubation period. There is another concept, that is median incubation period, which is the time required for 50% of the cases to occur following an exposure. Remember that incubation period is not a fixed time. It may be a range. Maybe after an exposure, in a person, the disease appears after 7 days. In another person, the disease may appear after 10 days of exposure. So as you can see, the time after which the disease or the clinical features appear in a person may vary. This is why the incubation period is generally a range. Here is an example. This is when a group of people are exposed to a particular organism. After a certain period of time, the first case appears. As the time goes by, the number of cases increases and it reaches the peak here, and then it keeps on declining until it reaches 0. So for the first case, so this is when the first case appears. So for this person, the incubation period is the minimum one or the least one. So this is the minimum incubation period, this time gap. So exposure and onset of clinical feature in the first person. Also, what is this? This is the if we draw a vertical line here, this is the time when 50% of the cases appear. As you can see, this is a bell shaped curve and this is symmetrical. So if we draw a vertical line here, we have 50% of the cases on the left side and 50% of the cases on the right side. So at this point, this vertical line here, we can say that 50% of all cases have appeared, and this is the time gap from exposure, which is known as the median incubation period. Alright, now coming to the next thing, what are the factors that determine the incubation period? Because incubation period is a range, it is not a fixed time. Generation time of the pathogen, we shall talk about generation time in next slide. There is portal of entry. For example, if a person is bitten by a dog on his leg, if the rabies occurs, it will take certain time before the clinical feature appears. So there is certain incubation period, maybe few days. If the person was bitten by the same rabid dog in his neck or head or anywhere closer to that, in that case the incubation period would have been shorter. That means he would have shown the clinical features of rabies earlier as compared to when he would have shown the features if he was bitten at his legs. So as you can see, the portal of entry or the site of infection can also determine whether the incubation period will be short or long. Infective dose, as in how much organism are entering the host. If the infective dose, that means a low amount of bacteria or virus is entering the body of the host, the incubation period may be a prolonged one. Whereas if there are a lot of virus or bacteria entering the host, then incubation period may be a shorter one. Individual susceptibility, of course, the level of immunity of all people are not same. Some people have very strong immunity, some people have very weak immunity. Maybe some people are on immunosuppressive therapy like corticosteroids or different types of steroids, maybe cancer treatment, etc. So because of that, some people may have shorter incubation period. Those people who have higher susceptibility to infection may have shorter incubation period. Incubating carriers are exceptions. What does it mean? We know carriers, they spread the disease to the other person and they do not have any clinical features. As a rule, infectious diseases are not communicable during incubation period. So when a person is infected but yet have not shown any clinical feature, that means he is in the incubation period, he is not generally infectious to other people. But there are certain exceptions where people can spread infection even when he is in incubation period. That means he has not shown any clinical features, no signs, symptoms. So it may appear that the person is absolutely fine, he does not have any disease, but in the meantime, during his incubation period, he has been spreading the infection to the other people. What are the examples? Measles, chickenpox, whooping cough, hepatitis A, etc. So especially measles, chickenpox, these are very much communicable respiratory infections among under 5 children. So a children who is apparently healthy, he may be going to the school, playing with other children and spreading the infection while he himself is in the incubation period. So this is very risky. We know about minimum and maximum incubation period in the previous slide here. This is the minimum incubation period because this is when the first case appeared, and when the last case appeared, this time gap from the exposure, it is the maximum incubation period. So that is why we can have a range of incubation period. Now let us talk about a very important concept, that is latent period and its difference from induction period. If you remember about incubation period that we discussed just few minutes back, incubation period is the time gap between the exposure to an infectious agent and the time when the first clinical feature appears. So any sign, symptom. But incubation period is in context of the communicable diseases or the infectious diseases. When you are talking about latent period, it is in context of non-communicable diseases. So there is no clear-cut exposure to any infectious agent because we are talking about non-communicable diseases. Rather, what we have in case of non-communicable diseases is the risk factors. there are different risk factors which can act individually or together to cause different non-communicable diseases. If you look at this diagram, we have point A, point B and point C. Point is when sufficient cause becomes operative. Let me give you an example. Let us talk about diabetes, which is one of the non-communicable diseases, which is very common. What are the risk factors for diabetes? There are multiple, but say for example, the risk factors we are considering here are unhealthy lifestyle, unhealthy diet intake and lack of physical exercise. So when all these risk factors start acting together on the body, that is considered as point A. When these risk factors starts acting together, it will take a little bit of time until there is any change at the cellular level in the body. So it may take few years until there is any pathological changes that start in the human body. So this is actually when the disease process starts at point B. This time gap between point A and point B, that means when the risk factor starts acting together and when the disease process starts at cellular or pathological level, this time gap is known as induction period. Now when the disease starts at cellular level or pathological level, it may not have any immediate clinical feature. So we may not be able to detect any clinical features like any signs or symptoms of diabetes. It may take few months, few years until the person shows any clinical features, or maybe we can diagnose the disease in the person with any available diagnostic methods. So there is always a time gap in between them. So this time gap between the point when there is any pathological changes in the body and the point when the disease can be diagnosed by available diagnostic methods, this time gap is known as latent period. So now I think you should have a clear idea what is a latent period and how it is different from incubation period. Coming to different importance of incubation period in epidemiology, we can trace the source of infection and contact. So suppose a person is suffering from a disease and the incubation period of the disease is 7 days. So we can ask the person if 7 days back he was in contact with another person with similar clinical features. So from that we can identify if that earlier person is the source of infection or not. Period of surveillance or quarantine. So how long a person or a group of people have to be kept under surveillance or in quarantine can be determined by incubation period, and it is generally equal to the maximum incubation period for that disease. Immunization, again same thing. The concept of incubation period is very important in case of immunization. We can identify the source of point source epidemic or propagated epidemic with the concept of incubation period. And prognosis, because if the incubation period is short, it is very common that the prognosis is really bad. On the other hand, if the incubation period is longer, the prognosis may be somewhat better. Serial interval. To understand serial interval, we must have clear concept about primary case, secondary case and index case, especially the primary and secondary case. So if in a given community we have the first person to get a particular infection and disease, then it is considered as primary case, and following exposure to the primary case, if there are other people who develop the disease, then they are considered as secondary case. The time gap between the incidence of a primary case and the secondary case or cases is considered as serial interval. Communicable period means during the time when the person transmits the infection, or we can say the person is infectious to other people. So let us look at the definition. The time during which an infectious agent may be transferred directly or indirectly from an infected person to another person, from an infected animal to man, or from an infected person to an animal, including an arthropod. So as you can see, there is an infected person or animal, and during the period of communication or communicable period, that infected person or infected animal can transfer the infectious agent to other person or other animal. So this is communicable period. Generation time, since we know about the communicable period, we have to remember that there is always a point of time when the person or the animal has maximum infectivity. That means that is the point when he can transfer or transmit the infection to other people or other animal at maximum capacity. So this generation time is the time interval between the receipt of the infection. So that means when he is infected and when he has reached the maximum infectivity. So this time gap is known as generation time. This can be same as the incubation period, or it can be shorter or longer than the incubation period. If it is same or longer than the incubation period, then we have the apparent cases, because by that time the person has already developed sign symptoms. We know the definition of incubation period. But if the maximum infectivity occurs before the incubation period, that means the person does not have any clinical features. So in that case, we can also have subclinical cases. So this is about generation time, the gap or the time gap between the receipt of infection and the time when the person reaches the maximum infectivity. Next is secondary attack rate or SAR, which is a very common short note and viva question, and it is defined as the number of exposed person developing the disease within the range of one incubation period following the exposure to a primary case. So this concept should be clear, serial interval, because we have to understand that the secondary cases occur following exposure to the primary case. So the source of infection in secondary cases are the primary case or primary cases if there are more than one primary case. Okay, so this is the formula. In the numerator, we have number of exposed person developing the disease within the range of incubation period. So these are the people who develop the disease following exposure to the primary case, divided by the total number of exposed or susceptible contacts. So these are the people who are in contact with the primary case. So primary cases are not included either in the numerator or in the denominator, and we multiply it with 100 because we express SAR in percentage. Let me give you an example so that you understand it easily. Consider an outbreak of shigellosis in which 18 persons in 18 different households or families all become ill. So there are 18 families, and in each family there is one person. So total 18 person becomes ill. One incubation period later, 17 persons in the same households as the primary cases developed shigellosis. So this means these 17 people who developed the infection or developed the disease later, they belong to the same household as the primary cases. So they got infected from the primary cases only. If the 18 households included 86 persons, calculate the secondary attack rate. So let us talk about a very small village. There are only 18 houses. Okay, 18 different households, and in those 18 households there are 86 members. So there are 86 people in that small village. Out of these 86 people, 18 people developed shigellosis. They are the primary cases. After being exposed to these 18 people, the rest of the people, 17 of them developed the disease. So they are the secondary cases. So we have to calculate the secondary attack rate. So primary cases 18, we know that. Susceptible population, we know the total number of people in that given community was 86. These 18 people, they are the primary cases. That means they already developed the disease, so they cannot be susceptible anymore. That is why we are subtracting 18 from the 86 and we are getting 68. So these 68 people are the susceptible population. So that means these 68 people were exposed to the primary case, because these people already developed the disease and all the other people in that community were exposed to the primary case and they were susceptible. So we had 68 susceptible people. Out of the 68 susceptible people, we have 17 secondary cases, because these 17 cases developed following exposure to the 18 primary cases. So if we go to the formula, secondary attack rate is 17 by 68 into 100, that is 25%. Why let me show you here. Number of exposed person developing the disease within the range of incubation period. So how many people develop the disease here? We know that is 17. And in the denominator we have total number of exposed or susceptible contacts. How many susceptible people we had? 68, because these 18 are the primary cases and they already had the disease. They cannot develop the disease again so soon. So that is why they are not susceptible. Rather, rest of the people, that is the 68 people, they are the susceptible. So 17 by 68 is 25%. So that is the answer. Some of the commonly asked questions from today's discussion are the definition and importance of incubation period, and how incubation period is different from latent period, what is serial interval, what is secondary attack rate. There can be epidemiological problem given on secondary attack rate. We also need to know what is generation time, communicable period, etc. So with this we conclude today's session. If you like the video, please subscribe to our channel and share this video with your batchmates, juniors and friends. We also have our Facebook page that you can follow. The link is given in the description. Take care, and we shall see you in our next video.